The senator from Wyoming.
Thank you, Mr. President. I ask unanimous consent that the quorum call be vitiated.
Without objection.
Thank you, Mr. President. Mr. President, I come to the floor again today to discuss Washington Democrats' one-size-fits-all health care scheme. Every American needs to know about this very radical plan. Democrats essentially want Washington, D.C. to take over all of health care in this country and to abolish private health insurance that 180 million Americans get through their jobs. Incredibly, this proposal, offered by Senator Bernie Sanders, has the backing of many leading Democrats running for president and 109 Democrat members of the House of Representatives. So I want to continue the debate today, Mr. President, by focusing on the terrible impact this radical scheme will have on all of the fine men and women who provide health care to people across the country. And of course, Mr. President, the impact on them will impact the patients that they provide services and, more importantly, provide care for. So I'm talking about the nation's dedicated medical professionals, especially those who serve in our community hospitals. You know, I actually know many of these healthcare providers because I'm one of them. For many years, I practiced orthopedic surgery in Casper, Wyoming. I was a medical doctor, a physician, chief of staff of the hospital at the Wyoming Medical Center. And when you practice medicine, Mr. President, in Casper, Wyoming, or anywhere in your home state of Nebraska, you really treat patients from all over your state. That's because many people in Wyoming live in small towns. I'm talking about patients in towns like my wife's hometown of Thermopolis, Wyoming. My wife's parents are there. When they need specialty care, they come to Casper. For those who haven't traveled in Wyoming, it's about a 2-hour drive on a day when the weather is good. And that's one way. Now, my point is, when you work at a Casper hospital, you're actually covering a large area in our state, and that's often the case in many states. So when I hear that Washington Democrats want to have a one-size-fits-all health care plan, I wonder, have they given any thought to people in the nation's heartland, people out west? Are they considering people in rural communities at all? I'll tell you. I think about the people of Wyoming every day. I'm there every weekend. The staff at small hospitals who serve rural communities like Thermopolis and Rollins and Lusk and Kemmer and the Lovell Hospital, where I was at a health fair this past Saturday talking to all of the folks there, their needs are things that I'm not convinced Washington Democrats have any knowledge or care for at all. The people at these hospitals work hard just to keep the doors open so they can continue to care for patients right there. So alarm bells go off when I see headlines like the one from the Washington Post. It said, "Who's going to take care of these people?" As emergencies rise across rural America, a hospital fights for its life. That's the headline, Washington Post. Now, the Post is referring to a hospital, a community hospital in Osage County, Oklahoma. The hospital has a sign out front that reads, "A small community is only as healthy as its hospital." That's the truth. Mr. President, hospitals across rural America are struggling, many, in fact, fighting for their lives. But still, Democrats are offering a plan that will destroy private health insurance in America, which is the lifeblood of our nation's health care system. 180 million Americans get their insurance this way. Democrats want to drastically reduce provider payments, which would, of course, drive many doctors from practice and shutter many small hospitals. The Centers for Medicare and Medicaid Services Administrator has said a one-size-fits-all system would, quote, decimate physician networks, creating a permanent physician shortage. Permanent. So how can rural hospitals survive with no financial cushion if Democrats' one-size-fits-all health care plan passes? Well, just ask the New York Times, of all people. Last month, the Times ran with this headline, "Hospitals stand to lose billions under Medicare for All." Hospitals stand to lose billions. The Times cites a study by George Mason University that found Medicare provider reimbursement rates are more than 40% lower than private insurance rates, 40% lower. At these payment rates, the Times says some hospitals, especially struggling rural centers, like those, Mr. President, in your home state and mine, would close virtually overnight. An overnight closure of hospitals under Bernie Sanders and the Democrats' one-size-fits-all scheme for medicine in America. Now, I'm sure a lot of people listening out there are thinking, maybe it's all a mistake. Maybe Democrats don't really mean to threaten hospitals. Well, the fact is, Mr. President, Democrats have long argued that hospitals need to close. That's what they've said. Just look at what Dr. Zeke Emanuel, who was an architect of Obamacare, a professor in Philadelphia, what he said on the subject. He actually wrote a book outlining all of this. It's called Reinventing American Healthcare. He said that 1,000 U.S. hospitals would close by 2020. Well, we're approaching that year. We haven't closed 20 in this country, but over 80 have closed, and Mr. President, those are rural hospitals. And last year, he published an op-ed in the New York Times, the same Dr. Emanuel, ominously titled, "Are Hospitals Becoming Obsolete?" He writes, "Hospitals are disappearing. While they may never completely go away, they will continue to shrink in number and importance. This is inevitable," he says, "and good." Well, not in rural America, Mr. President. Good, he says, if thousands of hospitals and patients who rely on them are forced to close their doors for good. I disagree fundamentally with his principle and what he is saying. And of course, all people who practice medicine in small towns want to keep the doors open because they know the impact on the lives of the people who live in those communities. You know, just last week I had a chance to visit with Dr. Mike Tracy, a family physician in Powell, Wyoming. He's past president of the Wyoming Medical Society. He's passionate about caring for his patients. And guess what? He doesn't participate in Medicare at all. Instead, he provides his services privately by charging his patients a set, transparent, monthly fee. He does what he does to keep his practice open. His focus is on his patients, not on Washington paperwork. And you know what? His patients are very happy. His practice is successful. The patients are happy with the time he is able to sit and be with them and look at them and focus on them instead of the mandates of a Washington computer screen. So you see, there are doctors like Mike all across the country who don't want a one-size-fits-all health care system. Many doctors and many small community hospitals cannot afford it, and they will not survive it. Certainly many rural communities can't survive it at all. Mr. President, you know this better than most as you've traveled your state and I traveled mine. If a small community loses a hospital, it is much harder in that community to attract doctors, nurses, teachers, businesses, all of the things that are vital for a community to have. So the threat is very real in what the Democrats and what Bernie Sanders and the one-size-fits-all health care plan would bring to our country. So let me just tell people that are watching the debate right now, Democrat one-size-fits-all health care plan, what this will mean for you is you will pay more to wait longer for worse care. That's what it means. That's what it means to you. You will pay more to wait longer for worse care. That is what is at stake here, Mr. President. And we all need to make our voices heard loud and clear. No to Democrats' one-size-fits-all health care scheme. Yes to real reforms that improve health care and bring down the costs for all Americans. Thank you, Mr. President, and I yield the floor.